The periolase has been really helpful in my general practice in that I've used it obviously for LANAP and the proprietary procedure that it's mainly made for. I'm seeing tremendous long-term results after LANAP. It's been a load of fun really just to see, initially you see a great result a year after the first treatment, and then even better within the next year quite often. And then seeing them, as the years progress, just as with any periodontal disease treatment or any treatment, almost any ailment, you may have to go back and do a little bit more work, but it's astounding how infrequently it's needed, but also impressive in that when an area does need some more to be revisited, it's usually very small. It's very quick, easy thing. But also I place a lot of implants and I treat a lot of implants, and people with implants that are having issues come to me. LAPIP is an interesting thing because I get people asking me all the time, well, what about this one? What about this one? Well, they show me an implant that's failing or ailing. And some will not be saved by LAPIP. Some probably never should have been placed, and you can't fix everything, but a surprisingly high number of them we're able to turn around and save using LAPIP. And in fact, I have one instance where ultimately we did LAPIP, and ultimately the implant failed, or it just wasn't enough. There wasn't enough bone there that I was comfortable long term, but the tissue around it had improved so much that it actually made for a better grafting site for placement of another implant later. Just being able to, because sometimes these areas can be very inflamed, angry, boggy, and infected. It's not, if you're going to take out an implant and graft it for future, it's quite difficult if the tissue is so beaten up that you can't suture it, or there's just lots and lots of inflammation and infection present. LAPIP has, it's a great go-to for even ones that I don't think have a great chance of succeeding. They often exceed expectations, but most patients are quite happy to try because they've invested a lot of time, effort, and money. They've undergone surgery to have this implant placed. They want to try and save it if they can. There are other lasers that can claim to treat periodontal disease, but there's no research to back them up. So I would say if you want to treat periodontal disease with a laser, my standpoint was always, well, it's either I'm going to not do it or I'm going to do it with something that has research and proof behind it. That was my personal approach to it. Once I got the laser and started treating it, my laser is plenty paid for. I never looked back, and I never had a problem making a payment on my laser. And the work that I did, the LANAP cases that I did alone, paid for that quite easily.